Hi, everybody. I'm Byron Day. Time now for another COVID-19 information segment with Fox News investigative reporter Brendan Kirby. Doing a little something different today. Brendan's back with us for an update on fighting the virus itself. And Brendan, one of the drugs we've heard a lot about is hydroxychloroquine, which is used to fight malaria. So what do we currently know about these tests on this drug?
Well, Byron, this has gotten a lot of attention since President Donald Trump expressed hope that it could prove effective in treating COVID-19 patients, but the jury's still out on that. Hydroxychloroquine and its cousin chloroquine, as you mentioned, are anti-malarial drugs. Hydroxychloroquine also has been widely used to treat lupus and other autoimmune diseases. Now, a French study last month suggested that it could have use in helping people who've been infected with the coronavirus, but that study was small and not based on a clinical trial. Another study published last week suggested the drug showed no benefit for a group of coronavirus patients at veterans hospitals in the United States, but that also has not been peer-reviewed. It continues to be used on some coronavirus patients, including in Mobile, although there are signs that interest among doctors is diminishing. Stat News reporting today that orders for the drug by hospitals have fallen 62% from April 17th to 24th.
All right, then there's another drug called chloroquine. How has that been used against COVID-19?
Well, Byron, chloroquine is a drug that was originally developed to fight HIV. It's been used since January in China, in Wuhan, China, where the virus first erupted late last year. It's also been used in the past to treat patients who had contracted SARS. Chinese doctors have reported good results in treating coronavirus patients with this drug, but a study published last month in the New England Journal of Medicine indicated that chloroquine, known also by the name Alluvia, was not effective as a potential treatment. Now, it's not easy to determine whether drugs are effective. You give medication to a group of people and some of them get better while others don't. But will the people who got better have gotten better even without the drug? That's the question that needs to be answered, and answering that usually takes months or years of study and carefully controlled trials. The problem here is that coronavirus patients don't have that kind of time.
And of course, we're continuing to track any efforts to find a vaccine as well. Brendan, thanks very much. Of course, Brendan will be back later in the hour to answer more questions about unemployment due to COVID-19. And by the way, if you have a question, just email it to him directly at brendan.kirby@fox10tv.com. He can't promise he'll answer every question, but he's certainly going to try his best. Lenise?